Have you ever heard that drinking garlic lemon water every morning will clean out your arteries? Or that eating chia seeds every day makes plaque disappear like magic? You're not alone. But here's the real question. If these tricks work as well as people say, why is heart disease still the leading cause of death? In this video, we'll take a closer look at the truth behind these so-called miracle tips spreading across the internet. We'll explain how plaque actually forms and, more importantly, give you the most practical tools to know whether your arteries are blocked. If you're looking for something more than blind faith in artery cleansing foods, you're in the right place. Online, you'll find hundreds of catchy headlines like "Miracle Drink cleans your arteries in just 7 days," or "$1 vegetable prevents heart attacks better than medication." Most of these popular tips revolve around mixtures of lemon juice, garlic, honey, apple cider vinegar, or ginger. Some even throw in turmeric, black cumin powder, or other unfamiliar ingredients to make them sound more mysterious. But what they all have in common is a lack of strong clinical evidence to support their claims. Many people are convinced because these tips seem natural, inexpensive, and free of side effects. But what they don't realize is that plaque doesn't form in a few weeks, and it certainly can't be removed with a handful of kitchen ingredients. Plaque builds up inside artery walls over many years, driven by microscopic damage, chronic inflammation, blood sugar imbalance, and abnormal lipid levels. No single food can reverse this process in a short amount of time. Garlic is a commonly misunderstood example. Some small studies in animals or lab settings have shown that garlic may influence blood lipids. However, that doesn't mean drinking garlic water in the morning will clean your arteries. The difference between a biological effect in a lab and a real clinical outcome in humans is significant. Even high-dose garlic extracts in supplement form have not consistently shown a clear benefit in reducing plaque. It's important to understand that when someone feels better after drinking a certain mixture, it's often due to the placebo effect or changes in their overall diet and lifestyle, not because the mixture is actually cleaning out their arteries. Belief is not a substitute for data. That's why we need to approach this issue with tools that are measurable and based on real evidence. Atherosclerotic plaque is not just fat floating inside the artery that can be flushed out like grease in a drain pipe. It's a complex mixture of oxidized cholesterol, inflammatory cells, calcium, and fibrous tissue embedded within the endothelium, the inner lining of the artery wall. This process begins with microscopic injury to the arterial wall, often caused by high blood sugar, elevated blood pressure, smoking, chronic stress, or prolonged sleep deprivation. These injuries trigger localized inflammation, trap cholesterol in the vessel wall, and oxidize it, leading to an ongoing immune response and the development of plaque. LDL cholesterol often gets the blame, but the real issue is oxidized LDL combined with chronic inflammation, not LDL itself. That's why two people with the same LDL level can have very different heart risks. One person who sleeps well, manages insulin levels, maintains a healthy lifestyle, and has low inflammation can live a long life even with high LDL. Meanwhile, someone who consumes too much sugar, rarely exercises, and has high triglycerides may build plaque much faster, even if their total cholesterol appears normal. Plaque doesn't just narrow the arteries, it becomes dangerous when it ruptures. A ruptured plaque triggers the clotting system to form a blood clot at the site, which can block blood flow entirely and cause a heart attack or stroke. What makes this more alarming is that even small plaques, which don't significantly obstruct blood flow, can still rupture without warning. That's why simply feeling healthy doesn't guarantee that your arteries are safe. And because this process is silent, slow-moving, and often without early symptoms, many people only discover plaque buildup when it's already too late. This brings us to the one tool that can truly help assess your risk, the coronary artery calcium score. If you truly want to know whether your arteries are building up plaque, the answer doesn't lie in taste, feelings, or popular remedies. It lies in modern imaging technology. A CAC scan, or coronary artery calcium scan, is a non-invasive, quick, and accurate method to measure the amount of calcification in the walls of your coronary arteries where atherosclerotic plaque often develops. The result is given as a CAC score. The higher the score, the greater your risk of a future heart attack. What makes this scan unique is that the CAC score isn't based solely on cholesterol levels. A person with high LDL but a CAC score of 0 may have a much lower 10-year heart attack risk than someone with low LDL but a high CAC score. That's why looking at blood lipids alone isn't enough. CAC reflects the actual physical damage in your arteries, not just a theoretical risk. Many modern physicians now use this tool to help determine whether a patient truly needs to start statin therapy. The scan only takes a few minutes, doesn't require contrast dye, and is relatively affordable in many healthcare centers, usually between $100 and $200. Most importantly, it gives you clarity about the state of your arteries instead of vague worry. If your CAC score is 0, you can be reassured that no dangerous plaque buildup is present, even if your cholesterol is high. On the other hand, if the score is elevated, it's a clear signal to take more aggressive steps with your diet, lifestyle, and medical follow-up. If there's no miracle food that can clean out your arteries, then what actually works? The answer lies in your overall dietary pattern, not a single ingredient. Modern research shows that a low-carbohydrate diet that improves insulin control and reduces inflammation is key to slowing or preventing the progression of atherosclerosis. Within this category, approaches like keto, carnivore, or low-carb whole food diets are being carefully recommended by many cardiologists for high-risk individuals. A diet that's low in carbs and rich in protein and healthy fats helps reduce insulin spikes, stabilize blood sugar, and lower triglycerides, all of which are directly linked to inflammation and endothelial damage. When done properly, keto has helped many people improve their HDL, reduce HOMA-IR scores, and, in some cases, even lower their CAC scores over time. That said, any dietary shift should be done correctly and monitored closely, especially if you're taking medications for diabetes or high blood pressure. What you avoid is just as important as what you eat. Cutting out refined sugars, white flour, industrial seed oils, and ultra-processed foods can significantly lower systemic inflammation. Instead, focus on whole foods like meat, fish, eggs, low-starch vegetables, raw nuts, and natural fats such as olive oil, beef tallow, and butter. Getting enough protein from whole food sources also supports muscle mass and metabolic health, critical factors after age 50 when muscle loss and insulin resistance tend to increase. In addition, nutrients like magnesium, vitamin K2, and omega-3s from food or high-quality supplements can further support arterial flexibility and reduce calcification. If you truly want to protect your arteries from atherosclerosis and the risk of heart attack, it's going to take more than a glass of lemon water or a spoonful of apple cider vinegar. You need to understand that plaque doesn't dissolve overnight, and no single food is powerful enough to reverse decades of accumulated damage. The most effective approach combines accurate measurement through tools like a CAC scan, structured dietary changes, and a long-term anti-inflammatory lifestyle. A low-carb diet, eliminating ultra-processed foods, increasing whole food intake, managing blood sugar, getting enough sleep, and incorporating daily light physical activity are the factors that truly make a difference. If possible, track inflammation markers like hsCRP and HOMA-IR along with your lipid panel. These numbers will tell you more about the state of your arteries than any subjective feeling ever could. And above all, remember this: if you see a video claiming that this food will melt away plaque instantly, that's a clear sign you should turn it off. Science doesn't work by magic. It works through data, time, and commitment. Your body deserves more than wishful thinking and internet hype. It deserves real, responsible care. If you found this content clear, honest, and helpful for your heart health, hit the follow button. On this channel, we don't sell quick fixes or make impossible promises. We provide grounded, evidence-based information you can actually use to make the right decisions for your body.